Hi you guys, I'm here with Jenda Stauffer and Angie, and we are live for your questions, our questions about what does it mean to have a midwife in regard to the journey of pregnancy and fertility. So Angie, do you want to just introduce yourself?
I am Angie Olson, and I've been teaching prenatal yoga at Lotus for, I don't know, 3 years or so.
A long time.
And I'm so honored to have Jenda here today.
Yes. And this is Jenda.
Hello.
And she is a midwife. And Jenda, tell us about exactly what that means to be a midwife.
Well, I want to say that I'm a certified nurse midwife because that is a little bit different because my track starts with nursing. I have my master's degree in nursing and a specialty in midwifery.
Did you hear that? A master's degree. What? Cool.
So when I try to explain that to a regular old guy, what I do, because a lot of men are familiar with nurse practitioners, so I tell him that I'm a nurse practitioner, but I also am trained to provide services for pregnancy, childbirth, breastfeeding, recovery, all that stuff.
And Jenda has not only been my midwife for over almost 12 years, but my GP. Like if I needed anything, I would just be like, Jenda, help me, this is my issue. So anyhow, I trust this woman with my life, and I'm so grateful to have her here and for you guys to get to know her a little bit more. Angie, do you have a question you wanted to start out with?
I do. One question that I get from prenatal students is, what's the difference between like a midwife visit and then an OBGYN visit?
I think the biggest thing would be time. We schedule our patients for 30-minute slots, and having worked with obstetricians most of my adult practice here, they probably schedule 1 or 2 visits about every 5 minutes. So they see an amazing number of people a day. I don't know how they do it. And we need our OBGYN colleagues, but so we schedule our visits every 30 minutes. So I think the biggest thing that people notice is time. So through that, we have time to develop relationships, have conversations, find out what how are you sleeping, what are you dreaming about, what are your fears, where are you at psychologically, where are you at physically, how's your relationship with your husband or your significant other, and not just listen to the baby's heartbeat and check your blood pressure and your urine and out the door. So a lot of relationship building, but a lot of coaching on the stages that are yet to come with pregnancy. So the biggest thing is time. The other is in education, because I'm a nurse. So education-wise, we're going to be talking about fetal development. We're going to be talking about aches and pains, signs and symptoms 3 before. I'm a breastfeeding specialist, so we make sure that I know how their nipples look prenatally. Do we need to be using any gadgets, 3rd trimester, so the baby can latch better and not have nipple pain. Talk to them what a normal latch looks like, what we're going to be doing in the recovery room, all that kind of stuff. I physically am down on the floor showing them what it's like to deliver in hands and knees or the squat position.
That's what I've been visualizing this whole time, hands and knees.
Or birth seat, and then how we transfer from those positions back to bed, for an exam after delivery. Bringing the dads with us to those visits so that they know what we're looking for. I always say that dads save the day all the time, because I want someone to give me a call when their contractions are 411, 4 minutes apart, lasting a minute. That's been going on for an hour.
That is so important. Did you hear that? 411, ladies.
So sometimes ladies will feel really comfortable. They're at 411. Now they're going on 3 hours of 411, and all of a sudden, the light switch hits, they shift into 5th gear, and they're like, whoa. So had he not called me right at that hour mark, then they could be in a little bit of a pickle on the way to the hospital because they waited too long. She didn't realize she would be so comfortable in the end. Does that make sense? So sometimes women will call me and they're like, they've been like this for a few hours. I'm like, you need to go to the hospital now. We're leaving now. We'll just get there and here comes a baby, and they made it, or sometimes maybe they wouldn't make it. So sometimes they're surprised how comfortable they are, and they're staying home.
I love to hear
until the
that.
last
I
minute.
do, because I think that in our society we always focus on, even when you watch TV or you read magazines or books, it's all about it's painful and it comes on really quick and hurry, get to the hospital. So I just love hearing that some women are still that comfortable.
Sometimes they're really comfortable, and I call it shifting into fifth gear. If they're, really comfortable to get to 7-8 centimeters and their water breaks, that baby could be there in 5 minutes. So we just want to be at the hospital, ready to go.
Yes.
Get the admission process done, get all that busyness out of the way so we can get the lights back down and get things calm, run a bath, walk the halls, whatever it is that we need to do. But now she's in a safe environment. I'm with her. When she transitions really quickly, I'm right there ready to go. And then it's not chaos.
Well, and I think also, kind of where you're going is with my next question. So I think there's some confusion about where midwives deliver. I think some people see that it's they just deliver in my house, but you're talking about a hospital setting,
right? Well,
not in Nebraska.
Right. Certified nurse midwives. In our legislation, we cannot do home birth. And so we know that home birth happens in Nebraska, but it's happening with people who are not trained, they're not licensed, they're not certified. There are different routes to midwifery, right? There are nurses who become nurse midwives, and then there are other people who are educated individuals who go through midwifery with a midwifery focus and not a nursing focus, but they still have to follow a very standard, specific education from certified programs, and they are licensed midwives. I don't believe that any midwife that's delivering babies in Nebraska has actually gone through those accredited programs. They are not certified in those programs, and they couldn't be licensed in any other state, not just...
Can I interject? So what, if I'm looking for a midwife and I want to just be sure 100% that this person is certified, what letters or accreditation will I look for after their name?
You would look for someone who is a certified midwife or a certified professional midwife.
Okay.
Or a certified nurse midwife. So there's a CPM, a CM, or a CNM.
Okay. And then are there websites where we could go make sure it's legit, that they really are certified?
MANA is the accrediting or controlling organization for the other type of midwives, and the ACNM is the accrediting for certified nurse midwives.
All you really just have to do is just call Guiding Hands.
Right.
Just go to Jenda, and then you're fine. And Lydia, of course.
And so what is the difference between delivery with a sort of traditional birth and then with a midwife?
If you think about a traditional birth, if you're thinking about a birth with an OBGYN maybe, right? I think that a classic fun example is probably about 2 weeks ago. I was at Methodist with a mom who, I think she was having her sixth baby maybe. Sixth baby. And we had a medical student with us. And by the way, people only get students with us if it's on their birth plan that says that it's okay. But so she thought that would be okay, and a student just watches. They're just there. She has her gown on, and she has her hat on, and her bonnet, and all this stuff on, and I just have my gloves on. And so she gets out of the tub, and she comes to the bed, and she's in hands and knees. And she's pushing in hands and knees, and then I have her get up, and she's ready to get up into a squat, right, on the foot of the bed. And I and the medical student we're on the floor. We're sitting like this, and we're ready to go. And she goes, "Can you tell me the rationale for us having her in such an unprecedented position or something like that?" And I was like, and then right then I was like, because it works. Baby. Here's the baby. And so she was just like standing there still, like, why are we in this position? And then she sees the baby come out, and she was just shocked. Right. So she said, I thought babies had to be born with moms on their back. I am not kidding you. This is a medical student. It's, she literally thought that
Stirrups
they
and
were
that.
supposed to be laying on their back with their legs up in stirrups. Why would we ever have her up in a squatting position?
Wow.
I said, because that's how women have always given
natural.
birth. It's
Yeah.
natural. If we just leave a woman alone, she will be just in that position because it is the most comfortable. So why would we turn her and lay her on her back? Why do we do that? We do it because it's more comfortable for us, the provider. So it's easier for someone to sit on a stool and just be straight on, so the provider's comfortable, right? And the woman's extremely uncomfortable. But for our deliveries, we're on the floor, or we're upside down, or we're sideways, and we're catching babies because it's more comfortable for the moms. So.
Okay.
So that's probably the biggest thing.
Right. Well, I feel like I had read at one time that when you are supine on your back and you're getting ready to deliver, the baby actually has a tougher time getting out because they have to sort of go down and up.
And that's why
because
they
of the
get a
pivot bone.
bad rap for laying flat and pulling their legs back.
Okay.
Because if you have someone like this back, they have that extra curve,
Sure.
right? But if you lay them all the way on their backs and they have a straight shot out, but now they're completely on their backs giving birth with no gravity,
Right.
right?
Right. Okay. And so one thing that we cover too in like prenatal yoga is we do a lot of the squatting positions and the sort of lunging and out of like lizard and trying to find those poses and kind of imprinting them. I mean, like you said, women naturally will just go there, but it's also kind of fun to practice, I think, throughout pregnancy too.
Yeah,
Just kind of
yeah.
feel what
And
feels good for you.
I think what they'll find is that we have ladies that I'll hear about from our nurses, that a woman has prepared her whole pregnancy to be able to push and bring a baby down, and then a doctor will show up and put them in the position that's most comfortable for the physician. And I think it's important to have that conversation with them. But most of our physicians, like for hands and knees, they just tell me they just don't know how to do it. They just are uncomfortable. All the maneuvers are backwards, and so they're just not. They haven't done it enough.
Sure.
And so I want to be able to have a medical student come with me for a delivery if we can share, some ways to help. Now, if somebody has an epidural, they can't get upright, and they can't push in an upright position. So they're forced to lay on their backs and bring their legs back because that's all that's available to them. So I am an advocate for natural labor. Only 30%, if less than 30% of our clients choose epidurals. And the reason why I want my patient to be mentally prepared for a natural labor without an epidural is because I have less baby drama. I don't need forceps. I oftentimes don't need C-sections.
Okay.
We can get a baby out in a timely manner if she has the power to push and be in upright, active position.
Well, and I think if people are looking for more information on that too, is it on your Facebook page or your website where you have like your stats for the last year of like what percentage in forceps and natural epidurals, all that information was on there. So super cool. So what I'm kind of hearing you say too, so having given birth twice in a traditional situation, I went into the hospital, visiting with a nurse who's checking me in who I've never seen before. And then when it's, maybe 10 minutes till time for baby to come, then my doctor comes in, and that's kind of how it went.
Right.
So I'm hearing that you're kind of there, maybe even when they check in, or?
Well, Lily and our practice is a little bit different. We limit our OB practice. So when a patient is in active labor and she's going to the hospital, we leave our beds and we go to the hospital, and I oftentimes am there on the unit before they even show up. So I'm helping I start their IV, I'm getting them settled. If I always check their cervix on admission. It's a personal issue for me. It's like head first, yes, it's vertex. For me, I always want to make sure I have a head coming down. Where are we at? And I always say that I get to find out if I need to phone a friend, which means do I need some extra help to set up because she's completely dilated, or is she 6 or 7 centimeters, and the nurse and I can do it ourselves. But and I think the admission process can sabotage someone, because if you get laid on your back to get the straps on and to sign all the consents, you're really uncomfortable and miserable, but that doesn't have to be like that. So if I meet my patients at the hospital, they're upright. They might be standing to sign the consents, or hands and knees, or on a ball, or whatever is more comfortable to get consent signed in between contractions, things like that. So we meet our patients at the hospital. We stay with them, whether it lasts 2 hours or 20 hours. We are there for their long haul.
That's great.
And if someone gets an epidural, then I sleep or I go back to the office and see patients or something.
Wow.
Otherwise, we're there all the time.
What an amazing job.
So most of our patients don't come with doulas. I think doulas are amazing. We know the research supports continuous labor support. Lydia and I just happen to be the ones that provide that continuous labor support.
Okay, great. And so I know that you were at Methodist previously, and what made you, what choice, what came up that made you to choose to leave and go
I
on?
think one of the last things that I remember is that I was waiting for a patient to get off the elevator. I practiced this way no matter where I worked, right? So I was waiting for my patient to show up, and she comes, and I didn't know if the person getting off the elevator was my patient or not, because we had a large group practice. She alternated between all the midwives, and it was probably 3 months since I last saw this person, and I wasn't quite sure if this is the lady that I was waiting for. It just told me that I was ready to make the leap. Last of my daughters got married that summer, so we had weddings all paid for, everything was paid for, and I decided just to make the leap.
Oh, that's great.
To be in my own practice. I worked for 6 months for free, so I had to make that financial leap, because with Global Care, we don't bill for our services until after the birth, so that meant that we went without that income for a while. So also I had to have things in place in order to be able to do that financially, to just invest in myself to go, and so that was one of the reasons why, that I could have a practice, that I get to see one person, not share them with anyone else. I'm an only child, so I'm a little so I get to be with the family and through their entire pregnancy, and then I'm the one that shows up for labor and delivery. If we're out of town, if I am physically out of town, Lydia will deliver them, and they have a beautiful, wonderful experience. They really do. She takes care of my daughters and daughter-in-law and all that. And so she's a fantastic midwife that I can feel comfortable stepping out of town, and she meets them at the hospital, does everything that I do, and we practice the same way, but we just have more satisfaction in our jobs knowing our patients that way.
Fantastic. Yeah. And so if someone's watching and they have maybe a few more questions and they're not quite sure yet, do you do like consultations with?
We have meet and greets.
Okay.
So they can just call our office and sit in front of us for a few minutes, ask us some questions. They can go to guidinghandsmidwife.com and learn, read about our services. They could shoot us an email through guidinghandsmidwifery@gmail.com. Or just stop in. We're in an office with a pediatrician, Dr. Whitcomb, and we have loved this small setting. A lot of our patients see our pediatrician in our office, and so we get to. I see my moms at 4 days after delivery. We run. They're in the office for a newborn weight check, and I do a breastfeeding consult, make sure that this baby's off to a good start. We coordinate our 2-week visits, our 8-week visits, so that they're going to one place, seeing both of us. And then we get to hug and kiss on little kids coming through for all their well checks, 1 year, 2 year, 3 year, kindergarten stuff.
What a great
It's just nice.
And you do get sleep at some point, right?
Absolutely. I sleep a lot, actually. I do great. It seems to kind of come in spurts. Sometimes we're sleep deprived. I've slept for 8 days straight now, so.
Wow.
Yeah.
That means something's coming, right? Is that like the kind
Yes, something's coming. It is right here, and she is coming.
9 babies due in like 21 days or something like that. So
Yeah, this is a busy time.
It'll be
for
busy
you.
time soon.
Awesome.
This one's gonna be quick, so.
Nice.
Angie, do you feel complete with your questions?
I do.
Okay,
Thank you so
awesome.
much
Thank
for
you for
coming. I
inviting
think, if there's interest, maybe we'll do one again in a few months. We do have a chiropractor scheduled to come next month and a pelvic floor specialist to come in September. So if you are pregnant, you want to do a little Q&A and then do a little flow after, come join us, Lotus House.
Yeah, or even, you know, we talked about this, that a lot of pregnant women have already chosen their provider, and I want them to stay where they're at. If I can just answer questions or help them along with you know, their journey, confidence. You know, labor is really mental, and we want you to be fit, but we want you psychologically to be just prepared to do what your body's made to do.
Amen.
Great, thank you so
I love
much.
it. Namaste, you guys.